welcome. You're watching the Health Talk session by Yashoda Hospitals. There has been a sudden outbreak of flu across the country which has sparked concerns. Almost every second person is experiencing symptoms such as cold, cough, fever and body pains. So what exactly is this flu and how do we prevent this? So let's discuss about seasonal flu in our today's episode. I'm Dr. Lakshmi and let's welcome Dr. Randeep Guleria, renowned pulmonologist from India. Welcome to the program, sir.
Thank you.
So, sir, in the past few months, we saw a significant rise of flu infections across India. So, is this something to be alarmed about?
So, you're right. In the last few years, we have seen a significant increase in the number of flu infection which are viral related. And that is something that we see every year, but the numbers are much more this year. And it's a cause of concern in the sense that the number of admissions or people coming to the hospital for healthcare are high. And on the other hand, it's not as bad as what we were seeing as far as COVID was concerned in terms of severe low respiratory tract infection. We do see a large number of people on the older age group who continue to have worsening of the underlying comorbidities. If they have COPD, if they have underlying ILD, if one is a diabetic or an elderly person, then this spring flu sometimes causes worsening of this underlying condition, or it can be more severe, leading to hospitalization and ICU admissions. I think this is something that we see every year. We know from previous data that during this time of the year when the weather is changing, viral infections, especially respiratory viral infections, tend to increase. But this year the number has been more, and I think that's related to the fact that last few years, because of COVID, these infections were not that aggressive or active, and also we had a lot of isolation, masking which was done to prevent ourselves from getting these infections, and for a long time our immune system has not responded very well to these infections.
So, doctor, what are the general symptoms one should be aware of, and when do you think one should consult a doctor for this?
So, the general symptoms are non-specific. They usually start off with fever, sore throat, blocked or running nose, a lot of body aches and myalgias, and some people will have chronic cough or cough which is usually dry but sometimes may have a little bit of expectoration. The body aches persist for quite some time, and many people tend to recover after about 5 to 7 days. But if your fever is high grade, if you're having a lot of cough with sputum production, or there is chest tightness or breathlessness, or you have comorbidities, you have underlying COPD, you have a heart disease, or you are an elderly person with other issues, then I think it's very important that you consult your doctor, because this so-called mild upper respiratory viral illness can sometimes become more serious and need hospitalization. So early consultation with the physician, I think, in the high risk group is important.
So, doctor, most of them have complained about prolonged cough lasting about a couple of weeks after recovering from flu. So, is that something to be worried about? Because that seems to be unusual.
Yes, that's true. We see a lot of patients who come with cough which persists for even up to 4 to 6 weeks. And these patients are actually classically say that they feel something is stuck in their throat and they keep coughing to try and clear their throat. This is something which happens as a part of a post-viral phenomena, but we're seeing it more, and I think it's a little bit of related to what we would say is hyperreactive airways. In some individuals, your airways have become more sensitive, and because of exposure to change of temperature, to pollution, that cough persists for a long time. It usually tends to settle with some time, but if it's persisting, you should consult your doctors, because sometimes you do need to take some medication, including inhaled medication, for it to actually go away.
So, sir, you've mentioned about medications. Are there any newer medications to treat this condition?
So, I think the most important thing is first to find out what is the cause of this spring viral fever, as we're calling it. Most often what we found is that when we do a nasal swab that this is usually influenza related, or one of the subsets of influenza which is causing this viral fever. If it is influenza related and you're in the high risk group, then you can take some drugs which are antiviral for influenza, drugs like oseltamivir, which goes abroad by the name of Tamiflu, and a lot of companies in India also make it. But I think along with that, symptomatic treatment in terms of anti-allergics, drugs for fever control, keeping yourself well hydrated are the important things that one needs to do.
So, sir, discussing about the treatment part, is vaccine advisable for this condition? And if so, who can take it?
So, there is a vaccine which we call the flu shot, the annual influenza vaccine, which is advisable for the high risk group, those who are in the older age group, those who have comorbidities, which includes patients with chronic respiratory diseases, heart diseases, patients on dialysis or with kidney problem, or those whose immune system is less effectively functioning. For them, the vaccine is useful. It's a quadrivalent vaccine, an annual vaccine, which covers for the circulating influenza strains which are there at that time of the year, and therefore this vaccine does help in preventing infection or decreasing the severity of infection. So I think it's important that those who are in the high risk group should take the annual flu shot.
So, doctor, now talking about the most important part, what are the precautionary measures that one should follow strictly?
So I would say that since this is a respiratory viral infection which gets transmitted mainly by droplets or aerosol, the precaution that we have actually put forward as far as COVID appropriate behavior is also important here. So if you are in the high risk group and during this time, it's a good thing that if you would wear your mask, if you go out to a crowded place, avoid going to places where there is a lot of crowd. If someone in your family has a cough and cold or a viral fever, better that he stays away from the high risk group, the elderly, and that may help in get the infection spreading. Often we see that what happens is that the children get this infection in school, they bring it home, and then they give it to their grandparents who have a more severe infection. So it's important that we take proper precautions. If a child is having, let's say, fever, cough and a viral infection, better that he stays at home so that he doesn't give the infection to other of colleagues at school, and at the same time take good precautions in terms of physical distancing, wearing your mask, regular hand washing.
So, doctor, before ending this episode, what message you would like to give to our audience out there?
So I would say that preventive health is more important than trying to look for treatment and medication. And for the current type of infection that we're seeing, the preventive steps are simple. Keep your immunity high by taking a good balanced diet, keep yourself well hydrated. If you're in the high risk group, you must get yourself vaccinated, and also follow appropriate behavior in terms of wearing a mask if you're going to a crowded places and you're worried about getting an infection, regular hand washing, and in crowded places try and maintain some degree of physical distances so that you don't get the infection. If you do these measures, I think you should be safe during this time of the year.
So, thank you, doctor. It was wonderful having you here on our program today.
Thank you. Thank you.
So, this brings us to the end of this episode. Hope this episode was informative on the topic seasonal flu, and don't forget to follow the precautionary measures, and do join us for the next week as well. Until then, take care and stay healthy. Thank you.